Hi, I'm Dr. Sanan, and in this video today, we'll be talking about the recovery after a deep plane facelift and neck lift operation. The recovery timeline starts immediately after the last stitch goes in. When you're in the recovery room, you will have a wrap that's around your head, holding pressure kind of in the area of the face and the neck, and you'll have small drain tubes coming outside from behind your ears that help get rid of extra fluid immediately after surgery. I see you the first day after surgery, and we take the dressing off, we clean your incisions around your ears and under your chin, and we remove one of your drain tubes. We then wrap your head up and you go back home. I then see you the second day after surgery, do the same wound care, and take out your second drain. Your stitches start coming out 1 week after surgery. I would say about 85% of your stitches come out that first week. The remaining 15% of your stitches, they come out the second week after surgery. During the first 2 weeks of surgery, this is what I call social downtime. Patients ask, when can I go out to dinner with my husband, with my family? And I typically tell them at about the 2-week mark, my patients start feeling comfortable. You can wear makeup on your face, around your incisions. You can wear your hair down over your ears. People will notice more of the fact that your jawline looks much sharper, your neckline looks much crisper. You do have some residual swelling and bruising, but you can cover that with some makeup. In terms of being red carpet ready, that means if you have a family kind of vacation or a photo shoot or some sort of major life event, you want to give yourself at least 2 months heads up to heal fully from your operation. After the 2-week mark when I see you, I follow up with my patients kind of at their 3-month mark from the surgery. In between 2 weeks and 3 months, the majority of your swelling will start dissipating. Patients feel that they're swollen along their cheek area, along the corner of their jawline, and along the edge of their neck. Some people also feel that under their chin it feels firm to them for about a couple weeks. This is very, very normal and to be expected after having a deep plane face and neck lift. The reason why is in this surgery, you're lifting the deep layer of the face, which means you're going underneath the SMAS layer. You're releasing all these ligaments that pull your face and your neck downwards. And when you're in that deep layer, there's going to be some swelling and edema to the tissues and therefore some scar tissue formation. That's that firmness you feel in the area where the deep plane stitches are placed. I'm a big proponent of telling my patients to undergo lymphatic massage therapy after surgery. Lymphatic massage therapy really helps decrease swelling and improves circulation to the areas that surgery was performed in, and therefore makes your healing time shorter. In addition, hyperbaric oxygen therapy is really important for my patients to undergo to promote wound healing. This helps minimize your scar. This helps improve your bruising and improving your swelling, therefore getting you back on your feet as soon as possible. My patients tell me that within 2 to 3 weeks, with the majority of the swelling kind of starting to fade away, they're really starting to appreciate their new jawline and neckline. What's really neat about deep plane surgery recovery is every time I see my patients for follow-up, at 3 months, at 6 months, and then closer to 1 year, the results get better and better with time. Minimal changes happen along the edge of your jawline and your neckline, and when you take your before and after photos, you see more definition that didn't exist before. This is a result of lifting the muscle layer and being in that deep plane that lets you reset someone's kind of facial shape and their age back to 10 plus years ago. I don't want to sugarcoat how the healing process works. Deep plane facelift and neck lift surgery is an operation where there is a lot of dissection to get you the most natural, refreshed result. However, there is a period of swelling that you have to go through to get to that end result. So when you do your pre-operative exam with me and your consult with me, I ask very thorough questions about, have you had filler previously, and how many times have you had filler, have you had non-surgical treatments, which includes laser, which includes threads, which includes radiofrequency microneedling, because that lets me counsel you better about what to expect in terms of swelling. In my experience, patients who've had years and years of filler or years and years of injectables like Sculptor or Radiesse or multiple rounds of radiofrequency microneedling, they tend to hold on to swelling or edema specifically along the junction of their eye and their cheek, this area, and that is called malar edema. That takes time to heal. Think of it as there's like a dam right here blocking any excess water or fluid from draining back down to your chest and to your heart. So lymphatic massage helps for that, ice helps for that, rolling helps for that, and ultimately just time. Your lymphatic system has to reestablish its flow after having surgery. Also, swelling can be asymmetric. One side might be healing faster than the other. You may feel more puffiness on one side of your jaw, you may feel more puffiness on one side of your neck, but you have to trust the process that at the 2-month, 3-month mark, things are really starting to turn the corner. I've seen people as late as 6 months take time for their malar edema or some persistent jawline swelling to go away. We can try medications that help with swelling and inflammation. We can try maybe doing some non-surgical treatments to try to heat the area, to try to melt that swelling away. Sometimes it works, sometimes it just requires more patience for the patients. Here's what you can and can't do after your deep plane face and neck lift surgery. You cannot do any sort of intense workouts like a Barry's boot camp or Pilates for 6 weeks minimum after surgery. You cannot go into a sauna or a steam room for at least 6 weeks after surgery. However, you can go on light walks, and I encourage you to immediately after starting the day after surgery. You can eat healthy foods that are rich in protein that are going to help your wound healing and minimize your scar. You can do lymphatic massages. You can do hyperbaric oxygen therapy. You cannot do a deep tissue massage. You cannot lie face down for any massage until you get your clearance from your surgeon. You cannot hop on a plane the first couple days after your operation. You cannot eat super oily foods, super fried foods the first couple weeks after surgery. You cannot drink alcohol for at least 2 weeks after surgery. Recovery from a deep plane facelift and neck lift is a process. Nonetheless, as long as you got clear guidance and you have a strong support system, you will get through it. And when you get to the end of the tunnel, you will look back and say, wow, this is the best decision I made. You will look 10, 15 years younger. You will look the way you feel, and that's the most important thing my patients tell me. They recognize a younger version of themselves, and no one has ever regretted undergoing a deep plane face and neck lift. You just got to understand the recovery you're getting yourself into, and I look forward to guiding you through the process. If you enjoyed this video, please like and subscribe to my channel and follow along for more educational content on facial plastic surgery.